Okay, hi, my name is Mercedes Harbert. I'm a student nurse. Today I will be changing your wet to dry wound dressing. Can I please have your name and date of birth? Okay, can I see your armband? That matches patient records. I will start by providing us with some privacy by closing the door or closing the curtain. And I will start by washing my hands. Do you have any pain? No? Okay, if there was any pain, I would have administered pain medication 30 to 60 minutes prior to this procedure. Okay, I'm going to start by gathering my supplies. I have my gauze, my sterile gloves, my tape, my clean gloves, my sterile field, my red bag, as well as my sterile solution. I'm going to take my red bag and put it within reach of the patient. And I'm going to start by applying clean gloves. Okay. I'm going to expose the wound. And remove the previous wound dressing. Okay. I will note the wound drainage for the amount, odor, and color, and I will discard of this in the red biohazard bag. Next, I will assess the wound itself. I will note the wound skin. I will note the wound edges, the wound closure. As well as any drains. Okay? Now that I'm done with that, I will remove my clean gloves and practice hand hygiene. Next, I will open my sterile field. And I will begin by pouring my sterile solution into my sterile field. I will note that it is the correct solution, and I will note the expiration date of the solution, and I will pour away from the label as not to get any of the solution on it. Okay? Next, I will apply my sterile gloves. May I use your legs to apply my sterile gloves? Yes? Okay. Okay, now that my sterile gloves are on, I will begin by cleaning the wound from least contaminated to most contaminated. I will use my pre-moistened gauze for that. And dispose of it in my red biohazard bag. Next, I will measure my wound. Okay, I'm going to measure the width, which is about 3 centimeters, and the length, which is about 13 centimeters. Next, I will measure the depth of my wound. As well as check for any tunneling. And I'll place the Q-tip. Okay, I got a depth of about 2.5. And dispose of this in my red biohazard bag. Okay, now I will pack my wound. I'll take my pre-moistened gauze. I'll stretch it out and coil it a bit for flexibility. Now in a real life situation, the gauze would be moistened and pack into the wound a little bit better. So I'm going to begin my packing. And again, if the gauze were wet, this would pack in a little bit nicer. Okay, and I would dispose of my Q-tip. Now I will place 2 4x4 gauze on top of my wound. As well as my ABD pad. Okay, at this point I can remove my sterile gloves. And apply tape to the ABD pad. I will apply tape to all 4 edges. Okay, I would date and initial the ABD pad after I've finished. And then I would practice hand hygiene, cover my patient back up. I would raise the side rail and lower my patient back down. As previously stated, my patient was raised to waist or working height and the side rails were lowered. So I would put my patient back in a safe position as well as leave them with the call light in reach. And I would apply gloves and clean up my area. I would discard of the red biohazard bag. As well as my equipment. Now that I'm finished the procedure, I would remove my gloves, practice hand hygiene, and then I would document. I would document the drainage of the wound, the amount, color, and odor. I would document the wound itself, the wound skin, the wound edges, the wound closure, and the presence of any drains. I would document the patient tolerance. And cleansing and irrigation.